It's Penn Action Healthcare for America Now, and we're here in North Philadelphia with Congressman Bob Brady and Dr. Marissa Rogers at the Broad Street Clinic, which is a federal qualified health center. And we're here to celebrate the first year anniversary of the signing of the Affordable Care Act. Very grateful to have Congressman Bob Brady here because he was one of the first members of Congress to sign on to the HCAN Statement of Principles and an event at the Constitution Center in October 2008. He's been a consistent supporter of the Affordable Care Act and of health care reform generally since then, and actually long before then. So we want to thank him for his work, and we want to hear from a few people who are going to talk about the benefits of this legislation for the people of the city and the people of the state and people of the country. First, Dr. Marissa Rogers, who is a doctor at this health center, is going to say a few words.
Hello, my name is Dr. Marissa Rogers. I'm the Chief Medical Officer of Spectrum Health Services. We're currently here at our Broad Street Health Center site. The Affordable Care Act has been a very important part of community health centers. Already, in the past year, there's some provisions that have made a significant difference in our patients' lives. For example, things like bars on lifetime limits of insurance, bars on denials of coverage for pre-existing conditions for children, and bans on copays for preventative services. That in particular is a particularly important issue for us. A lot of our patients have limited resources and really don't have the funds, even if they have insurance, to pay significantly high copays on preventive health procedures and testing. We look forward to the future of the Affordable Care Act, in which millions of people in this country who don't have access to health care will have access to reasonably cost health insurance. This will be an essential part of our ability to take high-quality care of our patients. The Affordable Care Act has also put billions of dollars into community health centers for operations, for enhancements, for growth. Our facility is actually building a new site for our Paddington Health Center, and these dollars are really essential to allow us to provide high-quality care for the patients in our community.
Thanks, Dr. Rogers. Danielle's going to read a story from a patient here, Kim Nunnally, who unfortunately couldn't be here with us today. She's someone who actually needs help and can't get it right now, but when the ACA goes into effect, she will be covered.
The testimony of Kim Nunnally. My name is Kim Nunnally. I'm a registered nurse and have been a nurse for many years. I've been unemployed since May when I moved from Las Cruces, New Mexico to Philadelphia. I've been unemployed because it takes a long time to get a Pennsylvania license to be a nurse, and I can't work as a nurse without one. I'm eager to get back to work. So now I'm receiving unemployment insurance. However, I don't have health insurance. In Pennsylvania, medical assistance is not available to adults my age if they don't have children living with them. I'm 52 and I have normal health issues for a person at my age. I have some chronic problems that are taken care of by prescription drugs that I have to take regularly. But I do have to take them regularly, and I need to have those drugs monitored by doctors. I'm grateful that the doctors at this health center can take care of me, but because I have no health insurance, I can't always afford the drugs that I need. I have to stretch out some medicines, and I've had to stop taking others. I'm lucky in that I'm a nurse, so I'm pretty aware of the risks I'm running and can try to minimize them. But I don't like to be in this situation, and most people in my situation would not be so lucky and should not have to stop taking medicine. When the Affordable Care Act goes into effect in 2014, people like me will be protected. If that act were fully in effect now, I would have good comprehensive health insurance, including coverage for prescription drugs. Either I would be able to get on medical assistance, or I would be able to take advantage of subsidies to purchase health insurance in the new health insurance exchange.
From Congressman Brady about
thank you. I want to thank Mark Spear and thank Penn Action for making this possible and letting people know that we're in a one-year anniversary. And without question, I want to thank Dr. Rogers. Thank you for the job that you're doing. There's some very tough circumstances. I know your funding is being heard again as we speak, and our Republican friends up in Washington seem to think that they don't really care about people that aren't feeling well. They don't care about sick people. You know, it's ironic. A lot of people start paying attention when you do get sick, and you realize that there is care out there, and a great job that the doctors and the nurses do, all the technicians do, to try to keep us healthy. And as the doctor said, you know, this health care bill, put a whole lot of people back on a program where they can try to stay healthy, keep healthy. It puts our young men and women, 26 years old, that may be still in school or still out there looking for a job, that can get health care and continue to get health care until they're 26 years old. It gets rid of the pre-existing conditions that the insurance companies try to utilize a lot by not taking care of somebody. So it does help the small businesses. They get the tax credits by offering health care for their employees. So it was a great bill, and I think that for the president, I was honored and happy to be the very first signer of it and vote for it. And I'm going to continue the fight to keep it where it's at and probably hopefully increase it a little bit more as we go along. Maybe get a culture shock. Maybe get a rude awakening to our fellow members and my colleagues on the Republican side to let them know that, guess what? I don't think this doctor in this clinic checks anybody's registration card when they come in. I don't think you care whether they're a Democrat or Republican or not registered. I just think you care that they're sick and you want to help them. And thank you for all you do under the tough circumstances. And I promise you keep on fighting, doing your job. I promise you I'll keep on fighting, doing my job. And hopefully we can get this thing permanent and start taking care of the people in our country. And we do have to worry about other people. We've got to worry about ours first. So thank you for the job that you do. Thank you, Mark, for having me. Thank you.
Thank you very much for your support of what we do.
Thank you. We'll continue to thank you.